Hi everyone, Alexander Diaz here at HawaiianIntegrativeAcupuncture.com. Today we're talking about heart disease, the leading cause of death in the United States. I feel so privileged to share my distillation of the underlying mechanisms of this disease and the best ways to cure it. I'd like to take a moment to thank my teachers, including Chris Kresser, Regina Dehen, Joe Coletto, Yufeng Shui, Zhenbo Li, and the thousands of dedicated researchers and scientists who are working to understand and prevent this tragic and unnecessary disease. If you enjoyed the video, please comment below, visit our website, and subscribe. I'm also available to treat patients worldwide via teleconference and find the best practitioners in your local area to help you improve your health. Heart disease kills millions of people each year and severely impacts the lives of countless others. It has profound negative effects on human consciousness and cognitive function. In Chinese medicine, the heart is the seat of the Shen, which means the mind or the spirit. So, heart disease damages people's ability to think and act with clarity. This further compounds their health issues because they make poor choices and have a difficult time initiating and following through with a plan. As such, not only the patient, but the family and friends of the patient must understand heart disease and how to cure it. Aside from experiencing an actual heart attack or other cardiovascular event, which clearly indicates a diagnosis of heart disease, we can diagnose at-risk patients in a number of ways. People who smoke cigarettes, are inactive or sedentary, get very little exercise, eat little to no fatty cold water fish, have high blood pressure, are overweight, have insulin resistance or diabetes, or have high triglycerides are all at an increased risk of heart disease. The more of these symptoms coexist, the more risky the situation. Standard lab tests conducted by most primary care practitioners can offer good indications of risk factors. But the most important evidence-based indicator of the risk of heart disease is the LDL particle number, or LDLP. It is worth asking your doctor if they can validate your testing of LDLP through your insurance. If they cannot, it is worthwhile to pay for this exam up front via the offices of a naturopath or functional medicine practitioner. Knowing LDLP is vital because standard lab tests are frequently interpreted wrong. High cholesterol is not necessarily a bad thing. There are many solid studies showing definitive evidence that people can have very low risks of heart disease despite high cholesterol, and others can have very high risk of heart disease despite having low cholesterol. This is especially important if your doctor is trying to prescribe cholesterol-lowering medications. These medications can have severe side effects, and once again, mountains of evidence show that their efficacy and value is actually far lower than the pharmaceutical industries would have us believe. That said, heart disease is extremely serious. If you or a loved one is diagnosed with heart disease or has risk factors and/or genetic predisposition to it, taking cogent and sustained action is necessary. In healing heart disease, there are two major categories. First is the homework you can do on your own, safely, without a specific prescription. Second is the work you do under the care of a skilled practitioner. Combining these two approaches is ideal and will have the best results. For safe personal homework, evidence shows that a number of lifestyle changes are key in preventing and curing heart disease. First is incorporate moderate physical activity every day, especially in the fresh air, and especially in the early morning or at dusk, when there's the most abundant energy for the lungs. For this purpose, I support Qigong, swimming, walking at a good pace, yoga, Tai Chi, and dancing. Getting enough sleep is also key. For this, it is crucial to be winding down before 9 p.m. Make an effort to clean your home, dim your lights, and shut down all TV, computers, and phones. Then with a red light or a headlamp, enjoy a good book or some quality time with loved ones. By doing this, you catch the wave of circadian rhythm and are asleep by around 9:45 p.m. The hours of sleep between 9:30 p.m. to 1 a.m. are the most valuable hours for healing the body. Stress management is vital to heart health. This means that first we have to use meditation, neurolinguistic programming like Tony Robbins, and other techniques to consciously relax. We must reframe our narrative about common stressors so that they affect us less deeply. We must also create a systematic retraining of the nervous system to have more peace, better breathing, and an increased feeling of safety. But we must also manage stress by consciously changing our lives. We must look at unhealthy relationships and work environments, at unhealthy media or concepts, and take space from them. Many people are challenged to do this because they fear for their survival, but conscious distancing from unhealthy persons, thoughts, and experiences is necessary to prevent stress. You deserve to live and work in a safe, loving environment where people care for and respect you. So between sleep, stress management, and exercise, patients can take responsibility for major aspects of their own wellness and make safe and sustainable changes in their lifestyles. As for the work that can be done with a skilled practitioner, there is much evidence supporting the use of things like curcumin, red rice yeast, tocotrienols, and glutathione. While these and other supplements are powerful and useful, research now shows that many of them are not actually bioavailable or digestible, and can overcomplicate the human system and even do some harm. Thus, they should be viewed in the same light as pharmaceutical medicines. They are only taken as prescribed in response to ever more accurate and in-depth testing and diagnosis, and from a secure and reliable source. A skilled practitioner can also help you navigate comprehensive testing for your gut flora, chronic inflammation, intestinal permeability, and thyroid function. You may also need to test your genome to determine if you have any risky gene SNPs that merit more specific treatment for heart disease. These are all important factors as etiological causes of heart disease. We want to create whole healing, so we should leave no stone unturned. Even as we make conscious changes in lifestyle, it is vital to seek the help of a practitioner who can support these and other elements of heart health. Finally, there is a growing knowledge of dietary impacts and healing nutrition for heart disease patients. I absolutely recommend the book The Paleo Cure by Chris Kresser and other dietary recommendations by the Kresser Institute for Functional and Evolutionary Medicine. Your personal practitioner can be even more specific and targeted with a nutrition program specifically tailored for you. Having regular appointments with goals, agreements, and accountability is the key to making lasting dietary changes for yourself and your family. Heart disease is preventable and curable. Every one of us can reference a loved one who has suffered or even passed on due to complications of HD. But with a solid effort, pragmatic changes to lifestyle and mindset, and the help of a skilled medical practitioner, patients can experience tremendous healing. Moreover, patients' consciousness can expand and become more healthy, creating better decisions, communications, and planning. This is crucial not only to healing their lives, but to every person they touch and to the planet itself. The earth needs us all to heal and create our greatest possible wellness. Let's work together to cure heart disease and benefit the lives of all beings. If you'd like specific help with a one-on-one consultation, please email me at hawaiianintegrativeacupuncture@gmail.com or feel free to book a treatment through our website. Thank you so much for the privilege of communicating to you about this important topic. May all beings be safe, free from suffering, and attain enlightenment.